Dear colleagues, my name is Chandra Kota. I'm a medical physicist with a keen interest in staff education and radiation therapy, currently working with my company, Integrated Radiotherapy Services. Today, I will briefly discuss my work on a structured approach for training and testing staff in radiation therapy. RT procedures are becoming more complex and surgery-like with new SPRT regimens and complex treatment techniques such as proton therapy, MR-guided RT, including adaptive, flash therapy, etc. RT teams' scope of knowledge and competency needs to be established to ensure procedures such as those listed above are carried out to a high quality. Informal survey of various institutions revealed an unstructured approach to competency testing for the team, usually observation and then performance of procedures directly on patients. Vendors of new technologies train on technical operation of their equipment and not on clinical aspects of procedures. There is an unmet need for structured approach to staff training and competency testing, post-residency, terminal degree certification, etc. This work was inspired by a need that arose during implementation of MR-guided RT program at Reading Hospital. Large gaps in staff knowledge existed for this very different technology. A Google search with the terms listed here did not yield any publications or articles that addressed the unmet need. A Google search for framework for clinical competence resulted in articles, links, and references to the pyramid structure introduced by Miller. This framework was applied to MR-guided RT to assess its suitability in filling the unmet need. Miller's pyramid framework separates staff training and assessment into 4 distinct levels. At the base of the pyramid is knowledge, defined as collection of basic facts required for the procedure. The next level, applied knowledge, is defined as the ability to draw on the knowledge and formulate a solution for the procedure. The third level, competence, is defined as the ability to demonstrate applied knowledge in a controlled setting, for example, in phantom simulations. At the apex of the pyramid, performance, is defined as execution of competence in the real-world setting on actual patients. Miller's framework was applied to MR-guided RT as follows. Knowledge is established through detailed curriculum on basic MRI concepts, operational and safety knowledge of MR systems, MR-Linac specific MRI and Linac knowledge. Test instrument is written quizzes. Applied knowledge was developed using a case-based approach to formulating simulation, treatment planning, and treatment delivery scenarios for various sites. Test instrument is long-form questions and interactive discussions. Competence is built through execution of applied knowledge on phantoms and patient volunteers. Test instrument is preceptor rating and accuracy of radiation distributions delivered to phantoms. Finally, performance is validated by demonstration of competence on real patients. Test instrument is peer review of various steps in the treatment process and a quality management program. The structured approach developed for MR-guided RT was implemented informally prior to patient treatments and helped in increasing staff confidence in performing patient procedures. The current work is a work in progress for sure, and the usefulness of approach needs to be validated in a multi-center setting. I'm looking for collaborators and institutions interested in implementing and testing this framework for various advanced RT procedures, such as complex SPRT treatments, gated treatments, etc. My contact is given here, and thank you very much for your time.